Hi, I am Dr. Kiran Kumar, Professor of Psychiatry and Consultant Psychiatrist from Bangalore. Today, we'll be understanding and discussing about a very important construct that we discuss in psychiatry, which are called anxiety disorders. Now, anxiety disorders are a very common group of psychiatric disorders. In fact, they're the most commonest form of anxiety disorders or psychiatric disorders worldwide. Now, you might be wondering, what is anxiety? All of us feel anxious, all of us feel worried, all of us are tensed. Okay. This is to a normal situation or a reaction to a normal event. But in case of anxiety disorder, the same anxiety becomes excessive, the same anxiety becomes overwhelming, and it starts impairing with the daily routine functioning of the individual. That is when we call that anxiety is no more normal, but it has become a disorder. What are the physiological signs that we come across in anxiety disorders? There can be symptoms of excessive worry, physical symptoms or physiological symptoms like excessive heart beating, tremulousness, excessive sweating, muscles becoming tensed, because of which we can have chronic tension kind of an headache, and there can be n number of other somatic symptoms like upper gastric symptoms, difficulty in evacuation of bowel, there can be diarrhea, there can be constipation, there can be reduced appetite, there can be increased appetite. So there can be n number of physical or physiological symptoms associated with anxiety. Lot of them also have cognitive symptoms in the form of excessive thinking, cloudiness, fogginess of their head, where they're confused, they find it difficult in making any kind of decision or judgment. Anxiety can be generalized, where it can be free floating anxiety, it can be there at every point of time, producing enormous distress to the patient. It can occasionally be in a social situation, where we call it a social anxiety disorder. Sometimes it can be very specific, where it is called as a phobia, where the patient will have a persistent irrational fear of an object, situation, or an environment. So it is very specific, and this is called as a specific phobia. Sometimes there can be a crescendo of anxiety, where the patient will have an intense episode of anxiety which stays for some time and then comes down immediately, and this occurs out of the blue. We call it as a panic attack. So anxiety in general can occur because of various reasons. So what are the common etiological factors responsible for anxiety? Quite a difficult question to answer, because what we say as professionals is it follows a complex model called as a biopsychosocial model. There are a lot of biological factors in the form of genetic factors. There can be a lot of psychological factors like the personality profile, and there can be enormous environmental factors and social factors. So this is called as a biopsychosocial model. If anxiety is so common, it's so prevalent, it's one of the most commonest type of psychiatric disorder that we see across, then can we treat it? Yes, definitely anxiety can be treated. If it depends upon the severity of anxiety, if severity is mild to moderate, mostly psychological measures are implemented. When it becomes moderate to severe, medications, a group of anti-anxiety medications, sometimes a small dose of benzodiazepines, and certain specific psychological measures in the form of cognitive behavior therapy is very helpful. If you ask me a question as a professional, how do we get out of this anxiety in general, or how do we prevent it? The most commonest thing that we say is we need to learn how to do our stress management. So what is this learn? L for laugh it out. E for adequate exercise. A for having a positive attitude. R for adequate rest. And N for good nutrition. These are what we need to improve in our daily routine. So anxiety is something very common. It's just not the normal feeling of apprehension that we have. Anxiety disorder can be overwhelming. We need to identify it, acknowledge that there is anxiety, and it can be treated by your mental health professional. Kindly destigmatize psychiatric disorders, improve your knowledge and awareness about anxiety disorders, meet your mental health professional whenever needed. Thank you very much.